back to my YouTube channel, and today we're going to be going over part 2 of my test for all cancer series. Today we'll be going over cancer such adrenocortical carcinoma and Kaposi sarcoma. Now first, let's watch a video introducing adrenocortical carcinoma. This video is called Histopathology adrenocortical carcinoma, and we will watch from 1 minute and 53 seconds to 2 minutes and 3 seconds.
Here is a tumor of some type of tissue of the kidney, like an adrenal gland. This is an adrenal cortical carcinoma. It's a malignancy of the adrenal cortex. They are very, very.
Yep. So just so you can get like a quick image of what an adrenocortical carcinoma looks like. And now let's watch a video introducing Kaposi sarcoma, the second type of cancer that I will be going over today. And it is also known as the AIDS-related cancer. And this video will introduce Kaposi sarcoma to you in 3 minutes. However, we are going to only going to watch this video from 0 minutes to 0 minutes to 0 minutes and 20 seconds.
Kaposi sarcoma is a highly vascularized tumor of the endothelial cells lining blood vessels. It's caused by the sexually transmitted human herpes virus 8 in patients that are immunodeficient, commonly due to HIV. It presents with multiple red lesions anywhere on the skin or mucosal membranes. However, it can become more extensive, involving the lymph nodes and visceral organs.
Okay, so that's it. And this is just to give you like a general overview of what Kaposi sarcoma is. Now, methods for diagnosis for adrenocortical carcinoma is, first we have the computed topography, which is a CT scan. And since adrenal glands appear on CT scans quite visibly, the location of the cancer can be determined by conducting a computer topography. Now, the criteria for identifying the identity of the adrenal tumor, adrenal tumor as a carcinoma or adenoma is as following. First, their size. Adrenal cancer is often suggested by tumors larger than 4 centimeters, which is around 1.5 inches. And shape can also be like a determining characteristic, and if the tumor is a carcinoma or an adenoma. Now, adrenal cancer is often suggested by irregularly shaped tumors with undefined membranes. Density can also be a major factor in identification. Like, adenomas are mostly indicated by low density tumors, since low density often suggests the existence of fat. And specifically, an adenoma is suggested by a tumor with an HU of less than 10. Now, another method of diagnosis for adrenocortical carcinoma would be the magnetic resonance imaging, which is the MRI. Now, similar to CT scans, the MRI shows detailed images of soft tissues throughout the body. Now, although CT scans are more commonly used to identify adrenal tumors, MRI are used in order to prevent exposure to radiation. Instead of using X-rays like CT scans, MRIs use radio waves such as strong magnets as well. And they can also acquire an extended amount of information regarding the tumors through an MRI scan. Since MRI scans tend to do a better job at distinguishing adrenal cancers from benign tumors. And this is just like a general image to your right, just like the anatomy of adrenal gland. And methods of diagnosis for Kaposi sarcoma may include a biopsy. Now, biopsies are typically used to make sure that a lesion was caused by Kaposi sarcoma. But during the biopsy, doctors will require a small sample of tissue from the lesion as well as shipping it to a lab for more analysis. Now, afterwards, a specialist doctor knows as a pathologist will diagnose Kaposi sarcoma through looking at the cells in a sample of tissue taken. Now, doctors will usually perform a punch biopsy for a skin lesion, which involves the removal of a tiny round piece of tissue. However, doctors can also perform excisional biopsies for an entire lesion to be removed, and those processes can be finished with just local anesthesia, helping numb the pain for the patient. A chest X-ray may also be conducted, on your lungs if they're testing for KS. If the scan displays abnormality, other methods of diagnosis, such as a CT scan, may be necessary to ensure the diagnosis of the patient. Now, another method of identification would be bronchoscopy. Now, a bronchoscopy is a test where the doctor looks into the windpipe, trachea, and the large airways of the lungs. Now, this process is usually done if you're having issues such as shortness of breath or if you're coughing up blood. And in other cases, the procedure may be done if the chest X-ray or CT scans indicate some abnormality. And thank you for watching, and I hope you all have a great day. I will see you next week.